my name is Emily Ethier, and this is my presentation for anatomical positioning and directions for BIO230 Anatomy and Physiology. First thing is, anatomical positioning is the erect position of the body with your face directed forward and your arms at your sides and your palms out. We can't really see the bottom part, but you're doing the same thing, like your feet are shoulder width apart. This is Matthew, he's our nice model, doing our anatomical position, just like that. There are a lot of different directions for this type of positioning. There's a lot of ranges of motion, so I'm going to go over a few different kinds or a few different terms for those. The first couple I'm going to do are front to back directions, and then I'm going to go into left to right directions and then limb directions. So first and foremost, we're going to go over superior is a term that is also known as the higher part. So if you use in a sentence, your nose, everybody has a nose, boop, is superior to your mouth. So it's above and higher than your mouth. The next one would be inferior. Inferior is lower. When you're looking at this through a lens, your nostrils are lower, are visible on the inferior part of your nose. Does that make sense? So it's like your tip of your nose is here, and underneath that, which is lower, is where your nostrils are. The next one is going to be anterior. Anterior is another term for toward the front. So if we're still talking about your nose, the nose is on the anterior part of your body. So it's the front part of your body. So wherever your anatomical positioning is, you're facing that. That would be what is toward the front. The next one would be posterior, which is toward the rear. So when you're looking at like the skull, your posterior direction is toward the rear. So that would mean that all of your posterior things that are behind you would be like where your hair would be on your skull. So it's like toward the back. The other one would be, the next one would be dorsal. Dorsal is toward the back of the torso. So that would be, if you turn that around, he's still doing that. Your shoulder blades are dorsal to your rib cage, where your ribs are. So it's like toward the back of your torso. You can turn this way. And then the final one for front to back directions would be ventral. Ventral means toward, I did that wrong. I'm sorry, I did that wrong. Dorsal is toward the back of your ribs. It's toward the back of your torso, not the front. That's what I meant. Dorsal, so your shoulder blades are dorsal to your ribs, so that's behind. And then the next one is ventral. Ventral is toward the front of your torso. So the navel, so where your belly button is ventral to where your ribs are. So it's like in front of where your body is, or the ventral part of the body. That is front to back directions. The next one we're gonna go left to right. So medial and lateral. Medial is closer to like the midline. So if you think of it as like you are drawing a line directly in between that splits from left to right halves, the medial line is what that is. So it's like the middle. So think of like your sternum is like your medial line for where the middle of your body is. Lateral is farther from the midline. So it's the, like, if you're going to say it, like your eyes are lateral to your nose. So they're not like, they're a little bit farther off to the side to kind of create like a V. So those are left to right directions. The next one is going to be limb directions. It's a little bit confusing. The first one is proximal. Proximal is closer to the point of attachment from your torso. So example of that is like if you were to take your arm and push it out this way, this would be where your proximal is. And that would be like you're closer to like your shoulder versus like your hips. Your elbow is like proximal to your waist. So it's like this, or your elbow like this going inward. And then distal is the last one. So distal is the one that's the farther point from attachment from where you're like extending. So like your ankle to like is distal to like your knee, because that's like in a point of direction. So those are the anatomical positioning directional terms. These are really, again, like I said earlier, these are really important for understanding how we all move in the positions of our body. And it's clinically important to understand like what people are talking about. It's more clear, it's more concise, and I think that it's something that can be used across a lot of different ranges of study. So that would be a clinical importance, would just be having a more clear and concise like anatomy term or term of anatomy. And then the difference between anatomy and physiology is that anatomy studies the structure of the body, while physiology studies the functions of the body. So if you were to take it and look at like the heart, someone who studies anatomy strictly would only look at like the heart's tissues for like just to decide what the functions are, and to decide like what's wrong with the functions of it, while physiology would actually look at the functions of the heart and like the blood flow and how it's oxidizing and things like that. So those are the terms for anatomical positioning, anatomy, and physiology, what the differences are, and why anatomical positioning is important for clinical use. So that's my video. Thanks.